Hi, welcome to Dr. J Off Air. This is a great time for you to find out a little more information and in-depth conversation about all of those great topics we talk about on Good Morning Texas. And Dr. Johnson is here to talk a little more about the topic of getting our body's swimsuit ready.
Yeah, it's that time of year. We're in the spring as we're filming this, and people are really thinking about it. But it's also something to think about year-round because the procedures take some time, and it's something that we can do any time of the year with pretty minimal downtime.
Right, minimal downtime. So some procedures are no downtime at all, some are a little bit more. So walk us through what we can do to help us get ready by summer.
We've got a real wide range of procedures because there's a wide range of needs.
Okay.
We have patients that have just a little bit of loose skin. And for those, we use Thermage, and we'll talk a little bit more about what Thermage is and does in a moment. But Thermage does a great job, the best job on the market, of non-surgically tightening that loose skin.
Right.
For folks that have a little bit of fat, that's not too bad, they just want a little shaping, we can use Liposonix, which is one of the newer tools.
Yep.
And it uses focused ultrasound energy to actually destroy the fat cells and permanently remove them.
Yeah, we're destroying fat cells. That is high tech.
Yeah, it's high tech and it's very effective. Now, it can't do everything that liposuction can do, but for certain people that just want to lose an inch or two and just want to lose a bulge here and there, it's a really good choice.
Okay.
Then we talk about liposuction, which is still the king. When it comes to doing shaping, liposuction allows us to remove fat where we want to, leave it where we want to leave it.
Yeah.
We can sculpt, mold, and we can change a lot of fat and do a real good job giving you a shape like you want. So liposuction is really key. And then for those that have a lot of extra tissue, that have had a lot of extra skin from pregnancy, have gained weight, and have a lot of extra fat and skin together, then we can talk about doing a tummy tuck or an abdominoplasty and make a real difference for those patients.
Okay, a lot of people are kind of nodding along at home. They're listening and saying, okay, I've had babies, I have that excess skin, I was afraid of going into a procedures, but so many of these, like you said, are done with little or no downtime. So that's a big selling point.
Yeah, Thermage is a great example.
Right.
Thermage uses radio frequency energy. People wonder what that means. What really happens is when we put the Thermage tool on your abdomen, all the water molecules line up, and then we 30 million times a second, if you can imagine that, we tilt them. So when they're going back and forth like this, it creates heat in the very deep tissue planes. That heat does a really controlled damage to our collagen.
Okay.
That's really important because that damaged collagen shrinks. And it shrinks real time. It shrinks as we're doing the procedure. So that one large study of 5,700 patients showed 87% of them reported, self-reported skin tightening immediately after Thermage.
Yeah.
But on top of that, that damaged collagen is recognized by the body as being damaged. So your body comes in and lays down about 3 or 4 times as much collagen as was damaged the first time.
Okay. And what's the benefit of that?
Well, then, when collagen matures, it twists and shrinks.
Okay.
That's what it does as it matures. And so we get initial tightening from the shrinking of the collagen, and then about 3 to 6 months later, we get further tightening as the collagen that's been laid down new in response to injury matures.
This is a really good way to explain it to people because we see the before and afters, we know it's fantastic, but this is a little bit more into the science and breaking it down into bite-sized pieces for GMT viewers.
And it helps folks that watch GMT on a regular basis and know that we talk about Thermage all the time.
A lot, yes.
It helps them to understand what's really happening and why this is really considered the best procedure out there for non-surgically tightening the skin, whether it's on the abdomen where it works, I think, the most impressively, whether it works on the arms, whether it works on the face. It's using this type of technology called collagen remodeling to give us the results we're looking for.
Okay, so we love that. We love skin tightening, we love little downtime, and we love the results.
Yeah, and as you mentioned, Thermage has no downtime. We like to use some medications to make it more comfortable during the procedure, but once the medications have worn off, you can go and have a completely normal evening and be back at work doing normal activities the next day.
I know, that's really good. I know because I've been a patient a few times myself. It's amazing, the results. Okay, so if we have a little fat to lose, we can upgrade, or maybe do something along with the Thermage. What do you recommend?
Well, Liposonix is probably one of the more exciting new tools to come out. For years, we've been looking for tools that would do essentially liposuction without having to do surgery. And Liposonix is one of the first tools here in the United States to actually deliver on that promise. Many talk about getting rid of fat cells and this kind of thing. This tool really does it.
Right.
This uses focused ultrasound. Now, when you go and have an ultrasound, like if you've been pregnant or if you're getting your gallbladder examined or something like that, you have an ultrasound, it's unfocused sound waves.
Okay.
That we bounce off and look at the reflection, and that's what gives us the fancy pictures.
Oh, okay.
This focused the sound on a single point, so that for a very narrow zone where that focus is, we actually heat and destroy the fat cells. Just almost exactly like what you do with light when you use a magnifying glass.
Oh, okay.
You focus it on a piece of paper and you can scorch the paper at that one little spot.
Right.
If you move it up, it doesn't work. If you move it down, it doesn't work. It's just on the one spot.
Okay.
Liposonix is doing the same thing with sound.
Okay.
The cells within the zone are permanently destroyed. Your body then reabsorbs that and goes to your liver, where it's treated just like any other fat you would eat or anywhere else. But where those cells are destroyed, they can't come back. So if we trim off the love handles, that's permanent. If you trim it off the tummy, off the male breast, off the inner thighs, anywhere we choose to take it, it's a permanent result.
That's great.
So you have to have an inch of fat in order to do it safely. And we only can think of it reducing it by about an inch, maybe 2 inches tops. Okay. So it's a great tool. It has some limits. The heat also tends to tighten the skin, so most of the time we don't have a trouble with skin looseness afterwards. If we do, guess what? Our friend Thermage is there.
Yeah.
We can come back later on and do Thermage on the area.
That's so great. A really good option for those who maybe weren't thinking of full-blown liposuction, but just those little tiny problem areas are making a big difference, and minimum downtime on that one as well. Okay, so if we have a little bit more, if we need the upgrade, if we want to really get rid of that excess fat, change our shape and size, what do we do?
Well, when it comes to changing shape, liposuction is beyond a doubt still the gold standard. Okay. And it has changed greatly over the years. We now do it in the office under local anesthesia. We call it tumescent because we pump in the fluid to make the tissue stiff, which French tumesce means stiff. And so we make the tissue stiff with the numbing fluid, which makes it painless. It makes it comfortable. You can still feel my movement. You can still feel pressure. You can still feel some vibration. We use a vibration-assisted liposuction to remove the fat most of the time. But it's comfortable, and you're awake or just a little drowsy during the procedure. So unlike other forms of liposuction under general anesthesia, which have a risk of blood clots, have a risk of embolism, those things just don't happen with tumescent liposuction.
Right, and that's a big benefit.
A big benefit. So on the tummy, we can make some huge differences. We not only can take off 3 to 4 inches if necessary, but we can also sculpt and give you everything from a very fit-looking abdomen to a complete six-pack.
That is so cool how you can go in, and the before and after pictures really tell the story, the sculpting with liposuction, especially on the men who have, you know, in the past thought this was a women-driven business, and then all of a sudden the men started lining up, and you see so many men, especially when it comes to abs.
We see a lot of men on abdomen and love handles, and you can make a real difference. And a lot of men that are fit and not even overweight have a lot of trouble with love handles, or just can't get those abdominal muscles to stand out the way they want. And doing liposuction and then doing the sculpting can make a huge difference.
Make a big difference. Okay, so what if we have a lot of extra tissue around our stomach? What else could we be doing?
Well, for those that have had a lot of weight loss or have developed where skin folds over the lower abdomen and touches other skin.
Okay.
We refer to that as redundant skin.
Okay.
When you have that, you're usually in the realm of needing an abdominoplasty or what's known as a tummy tuck.
Tummy tuck, okay, and that's something that you offer.
That is something we offer, and something that can be done under tumescent anesthesia.
Which is great.
And one of the advantages of doing it under tumescent anesthesia is we do a liposuction-assisted tummy tuck. Okay. So where some patients have had a standard tummy tuck, still have a lot of fullness in their upper abdomen, where the fat's not been as reduced, we can reduce the fat quite nicely in the upper abdomen. We're doing it under local anesthesia, so most patients honestly sleep through the tummy tuck portion, but we can easily awaken you. You go home, you don't have to recover from the anesthesia like normal.
Right.
So it's a great procedure. It takes about 4 to 5 hours in the office, but it's done here in the office, and patients go home the same day.
Okay, it's really great, and especially like I said, when you explain it like this, you take the fear out of it. It's so safe, it's comfortable. You use those words a lot when you refer to these procedures. The best thing to do is come in for that consultation. Everybody's kind of story is different. They may be surprised that a conservative method would be effective to get those results they need.
And we have highly trained consultants that they meet with first, and those folks are able to direct them in the right direction. But everyone now meets me before they actually have a consultation, before they actually have a procedure.
Okay.
So if they come in to get a consultation, they may go ahead and put a deposit down if they want to schedule, and then before they actually have their procedure, I meet with them, I examine them, make sure what their goals are, and make sure that they're doing the right thing for where they're wanting.
Okay, that puts anybody's mind at ease. All right, Dr. J, thanks for spending time off air with us today.
Thank you, Amy.